Welcome, fellow Brainiacs. It's great to see you. For those new to the channel, my name is Dr. Martin Rutkowski, and I'm an assistant professor of neurosurgery with expertise in brain tumors. In the world of mixed martial arts, head injuries are common and they can be brutal, and UFC 248 was no exception. In the co-main event between Zhang Weili and my Polish sister, Joanna Jedrzejczyk,
Joanna Jedrzejczyk.
Joanna Jędrzejczyk. Joanna suffered a severe and disfiguring head injury, one that thankfully was not life-threatening. And if you're wondering to yourself, did I really just have to call my mother to figure out the pronunciation? No, I didn't. So how can we explain what happened in this fight? How Joanna went from looking completely normal on the right to how she looked at the end of the fight on the left? The answer lies in a basic understanding of scalp anatomy. So we'll cover that in brief detail, as well as the strikes that she took during the fight that explains the formation of this large hematoma, or blood clot that spread from across her forehead to her temple and face. Joanna most likely suffered something called a subgaleal hematoma, which is a blood clot that forms beneath the galea, which is a fascial continuation of the muscle known as the frontalis, the muscle that helps us move our forehead and raise our eyebrows. Early on in the fight, you can see that Joanna absorbs a blow directly to her forehead, in this case from Zhang's left fist. As she begins to walk off after the round, you can start to see the formation of a large blood clot that looks like a bubble in the center of her forehead. Because this isn't the normal type of swelling in which a tissue starts to bruise, but actually the formation of a blood clot, the usual maneuvers that you could use, including an ice pack or direct pressure, will not actually help prevent formation of this enlarging hematoma. Later on in the fight, she absorbs another blow directly to the area where that hematoma began to form, worsening her injury even further. By the end of the fight, when she's walking off after the final round, you can see the damage has been done. Unlike explanations elsewhere that suggest that thin skin over the forehead or leaky blood vessels might be responsible for the formation of this hematoma, we can use basic anatomical principles to understand how and why this hematoma formed. So with that being said, let's do a quick 1-minute anatomy review on the layers of the scalp. The scalp contains 5 tissue layers, which can easily be remembered using the mnemonic SCALP. S stands for skin, C for connective tissue, or fat, A is the aponeurosis, another medical term for the galea, L is loose areolar tissue, a layer that we'll get back to shortly, and P is periosteum, or pericranium, a tissue that exists directly over and is attached to the surface of the skull. The L layer, made up of loose areolar tissue, can be thought of a little bit like a spider web. It has almost no structural integrity and really exists essentially as a potential space. So therefore, any trauma to that area allows blood to quickly fill that space and track along its plane. Because there's no inherent resistance within that plane, blood that forms can easily start to pool and enlarge, in this case forming what's called a subgaleal hematoma, what I believe happened to Joanna. The potential space within the loose areolar plane extends from the front of the head out towards the side, and therefore any rapidly expanding hematoma will disfigure both the forehead region as well as the lateral temporal region, as can be seen in Joanna's case. Despite her attempts to use ice and cold compression to stop the formation of the hematoma, this is ultimately a surgical injury. Normal swelling is caused by a bruise or a contusion, which is an inflammatory response to an injury. However, in her case, the actual formation of a blood clot necessitated surgical removal. Now, if you can explain these bandages, that would be news to me. Typically, this is done with a single incision, usually behind the hairline so that it can be hidden. And thankfully, it looks like she had a great outcome.
A mud mask, of course, I'm still having so many bruises on my face, on my chest. The swelling went down, but I feel better. So we good, about to go to sleep. I cannot wait to enjoy my family and friends. But be safe, guys, okay? Be safe. Kisses.
In spite of a brutal injury, it looks like Joanna had a great outcome. She underwent evacuation of her hematoma without any apparent complications. Now, if you're wondering, how could she possibly have escaped this fight without any major injuries? Well, I think of the skull a little bit like an internal helmet, and in this case, it clearly did its job. Thank you again for watching. If you appreciate this video, be sure to give it a like, and don't forget to subscribe if you're not already part of our growing Brainiac community. Look forward to seeing you in the next video.